थोड़ा सा टिल्ट भी कर लीजिएगा, हल्का सा, आप ऐसे हो जाइए, या थैंक यू, थैंक यू। विच दैट इज द नी, हाँ द लॉन्ग नीडल है ना, तो द टिश्यूज आर पुटिंग देयर प्रेशर। No, it's not bent, it's a straight needle.
So you put in the contrast? Yes.
Yeah, see, you can see the contrast.
Yes.
ठीक है?
Right.
Right. Now, see, this is typically one root that is getting affected, though I have injected very small amount. अभी दिखाइए. So, the root is very well seen.
Yes.
मेरे को स्टिलेट देंगे जरा.
Some amount of epidural is also
Flow is there, yeah.
Yes.
But you know, because the needle is like not absolutely inside, so I've just pushed it another millimeter or two. जरा दिखाइए, शूट कीजिए. अब शूट कीजिए. शूट. ओके. ड्रग डाई दीजिएगा फिर से. Shoot, please.
Because we use such a small amount of dye, what do you do with the open ampule?
Arey, that goes waste, Baba. Okay.
We can reuse it?
No, we generally can't reuse it. The only thing you can do is you can keep multiple cases as today. Shoot. Okay,
Left.
now you see the epidural dye.
Mainly left.
देखो,
yes.
है ना? तो
हाँ.
I had pushed the needle a little bit inside, so now both epidural भी जा रहा है. ठीक है, तो now I am giving 1.5 sensor gain. हाँ, yeah. Okay, Dexa please.
हाँ, Ashish, the audience wants to see the lateral view also.
दिखाओ भाई lateral view also.
So you have given sensoricane followed by Dexa.
मतलब थेरापेटिक दे सकते हो आप. या सॉरी दीपक, क्या?
Sensoricane followed by Dexa.
Yeah, and then followed by, I just give a little bit more 0.2 cc of sensorcan in the end also, just to push, because there's some amount of drug remaining in the. देखो, you can see beautifully the epidural lining, anterior as well as posterior. पूरा thecal sort of myelogram दिख रहा है एक type से.
Correct.
Okay. So this is done. Now I'll try to show you the epidural. AP करेंगे? अच्छा एक मिनट छोड़ दीजिए. वो हाँ, चलो ये दिखा दो. ऐसे रखिएगा. This was the needle, I think. Shoot करना please. Okay. Now we are trying to put in a epidural, हाँ?
Right.
चलो अभी मुझको आप एपी दिखा दीजिए. यही था ना? इधर दर्द तो नहीं हो रहा ना आपको? थोड़ा हल्का. हाँ, ठीक. हाँ, अभी हाइट बढ़ा लीजिएगा सियाम की आप. अभी थोड़ा सा ऐसा टिल्ट कर देना इस तरफ को. हाँ, बस अभी शूट करके दिखाइए. अभी शूट कीजिए. ओके. और टिल्ट कीजिए. अच्छा, दिस if you look at the X-ray, artery once again. So see here, this is not proper squaring. Okay, what I mean is, you see there is one end plate here and the other.
Right.
So that is what basically we mean by squaring. Tilt kar lo.
So both should be
parallel,
visible as one line.
Yeah. Like we do for the pituitary surgeries, where the base is like parallel. मशीन नीचे के ऊपर. नहीं, पेशेंट को ऊपर ले लीजिए। आप थोड़ा ऊपर जाएंगे क्या? करिए, ऊपर हो पाएंगे? और होइए। ओके, तो स्लाइड इट देन। चलो अभी शूट करो, देखें। नहीं, वो रॉड ही है यार, पर अपना L5S1 आ जाएगा। हाँ हाँ, शूट प्लीज। ओके, गुड। शूट प्लीज। नहीं, नाउ इट इज स्क्वेयर्ड, स्क्वेयर्ड।
Now it is looking much better.
या थोड़ा सा आप चाहें तो और टिल्ट कर लीजिए, थोड़ा सा और कर लीजिए। कैन आई जस्ट गेट सिंपल Xylokin? Xylokin। ये क्या? व्हाई डू वी हैव अ बार यार? पेशेंट, चलो कोई, वी एक्सेप्ट वो थोड़ा सा, आप इसको थोड़ा टिल्ट कम कर लीजिए। बस बस बस। ओके, शूट। The reason I am just accepting it because it's in an interlaminar, ऐसे भी रहिएगा आप। बस बस बस। हाँ, शूट नाउ प्लीज। ठीक है, शूट। ओके, नीडल प्लीज, लोकल। एक सुन की सुई लगाएंगे। बस बस, सॉरी सॉरी। नहीं नहीं, टू ही। या स्पंज प्लीज। नहीं, जस्ट द गॉस।
Here, which needle would you use, Ashish?
We'll use the same needle as sir was using, the Tuhi needle blunt.
Okay.
Yeah.
Is it the same one we use for lumbar drain placement? Can we use that?
Yeah. It's the same thing, but क्या है, we get the kit जिसमें loss of resistance needle भी रहती है, syringe रहती है.
Okay.
So with that sort of you have the complete set with you. हाँ, epidural. The sort of resistance varies a little. अपन ने करते हैं ना, कई बार वो अटकता है. This is more smooth and you know. So this needle is a little sort of blunt ended. Yeah. Shoot करिए. Shoot please. Okay, lateral कर दीजिए. इसको सीधा करके lateral कर दीजिए. Same, four. Yeah. No scarring. But when we used to use particulate, we used to have those white steroid particles seen. And even with endoscope, when people use that, when you go in endoscopically, you can see the particles. Yeah, थोड़ा आप height नीचे कर लीजिए. और करिए. Height नीचे. और करिए. Yeah. Now shoot please. Okay. Right. So what I just wanted to show was, shoot करिए. Okay. Syringe please. Shoot करिएगा. So here you see, है ना? Yeah, bouncing back. And then feeling. Yeah, bas. अभी भी I am ligament आ रहा है. Shoot please.
You can feel the ligamentum flavum now?
Yes, yes, I can. Sorry. Yeah. ठीक है, दिखाइए, shoot करिए. Yeah, now there is give way, sort of. वापस. But we'll confirm. Here you can easily confirm giving the dye.
Yes.
Again, the same principle, small amount initially. Shoot, please. Okay, this is good epidural flow.
Right.
Okay, so I don't think so we need to put any more, and we can just, yeah, sensor can play. Steroid. Then sensor can again. बस हो गया भैया.
Same thing, Sensorocane followed by Dexa followed by Sensorocane.
Yes. Shoot please. So that is, the dye has been flushed out now. Okay?
Right. Understood.
Yeah. So it's done.
So
Still.
Has the patient got relief?
अभी आएगा.
Any questions? Anybody?
Yeah, sir. Sir, these patients, if they require surgery later on, do you ever find more fibrosis there when you eventually have to operate them after 3 months or
Okay.
6 months? Or
So
any difference is there?
no,
or not?
no fibrosis. But when particulate steroid are used, we on endoscopy we can very clearly see white shining steroid particles that we are able to appreciate. Until unless you've caused hematoma, there is no scarring as such. The other thing is there is reported literature that frequent blocks leads to increased frequency of infection post-operatively. So after surgery. So basically to avoid too many blocks if the patient is not getting benefit.
Sir, if there is any dural injury, it's a very small, can we leave it like this, the rent, or we have to do something?
See, you will not appreciate because you're not, how will you appreciate that there is only after the procedure when the patient complains of positional headache, I'm sorry, will you be able to, find out that yes, you have sort of, especially in lumbar cases, or when there is a frank CSF coming out from the needle, then obviously you are very sure that you have punctured, but nothing to be done as such.
Okay, sir. And how long you want the patient to be in prone position after giving the injection?
So prone position just about 10 minutes, 5 to 10 minutes, and then lying down for another 20 to 30 minutes, and then start ambulating.
You ever required a lumbar drain for these cases if at all you puncture?
No.
Okay, thank you, sir.
Okay, the question Ramesh is asking is urinary complaints by the patient. Obviously, if you give too much of drug and it is sort of causing a block as such of the extra nerves, so that is generally happens when you are giving extra amount of drug.